Bismillahirrahmanirrahim. A quote of the day is, "The Prophet said, charity does not in any way decreases the wealth." Today, the topic of my presentation is Keilman's model of health system, and I am presenting it under the supervision of my professor, Dr. Saira Afzal. Learning outlines of the presentation are introduction of districts, district health planning, models of health planning, Keilman model of health planning, decentralization, purpose and impact of decentralization along with recent updates. Learning outcomes are at the end of this presentation, participants will be able to describe about the introduction of health system modules in districts along with the Keilman model and concept of decentralization. As defined by World Health Organization, the district health system is more or less self-contained segment of a national health system. It includes all the institutions and individuals concerned with the improvement of health. As a decentralized part of the national health system, the district health system represents a manageable unit which can integrate health progress and program by adopting top-down and bottom-up planning, and is capable of coordinating government and private sector efforts. It can identify inequities in the sector and target them for action. Furthermore, it is the minimum level at which joint intersectoral action is possible and the community participation is more feasible. The three main criteria that are used for defining a district health system unit are: first is a clearly defined area with local administration and representation of different sectors and departments. Second is an area which can serve as a unit for decentralized intersectoral planning of healthcare. And third is a network of health facilities which with referral support. Districts in Pakistan. The district is the basic administrative unit in Pakistan, which has been further reinforced with the establishment of elected local governments under the Local Government Ordinance 2001. The presence of district managers and supervisors led by the Executive District Officer EDO Health, District Health Officer under the previous setup, offers the opportunity to function as an effective team with support from the representatives of other departments, NGOs, private sectors, as well as the community. Purpose of District Health Planning Manual. Under the local government, the district managers in health shall perform several functions which were either being done for them by their provincial counterparts or were not being done at all. Among these, an important function is the development of district health plans, strategic as well as operational. Use of information for preparing these plans, plan implementation, and its monitoring and evaluation. This manual has been developed in response to capacity development needs of the district managers and the district health planning management team in the area of district health planning. The purpose of the manual is to enable district health system management team for correctly identifying community health needs and priorities, systematically assesses the healthcare delivery system. It defines appropriate interventions based on identified problems, ensure equity in the distribution of services among the population, coordinate ongoing healthcare activities, including priority programs at the district level. Health system conceptual framework. Several models of health system have been developed to illustrate the various components, functions, goals, and objectives of the health system. Each model demonstrates different aspects of the system. No model is universally accepted as a perfect model. However, two health system models are presented here. First is based on system approach. The second model has relatively recently been proposed by WHO and is the theme of Millennium World Health Report 2000 on health system improving performance. Elements of health system. The three elements are highly interdependent. First is environmental ecology, that is socio-cultural, demographic, economic, political surroundings largely determine health problems and health needs of the community and exert a major influence on the nature, volume, and quality of health service availability. The extent to which a community is involved in the healthcare influences health problems and health needs on one hand, and the nature and quality of health service delivery on the other hand. And lastly, the community largely determines the socio-cultural milieu and exerts a considerable influence on the physical environment. This picture shows the management organization support system, or that all the factors that are affecting health system, social, cultural, environmental, political, economic system. Now, what is service inputs? Are service programs, service delivery, and three M's are included in the service inputs. Service input is an important aspect of the health system manual. Essential programs and complementary programs are included in the service program outline. Service delivery infrastructure and modes of program delivery are under the umbrella of service delivery structure, while material, manpower, and money, these are the three M's that are important components of this. Health system model, functions, and objectives. Objectives of the health system. First is improve health status, improve overall health status of the population and reduce morbidity, mortality, and disability. Fair financing is financial protection from the cost of ill health. Third is responsiveness to clients, dignity, confidentiality, autonomy of clients, and prompt attention, quality of amenities, access to social support network, and choices of providers. Functions of health system are provision of health services, raising, pooling, and allocating revenues to purchase those services, investing in people, building and equipments, acting as the overall stewards of the resources, powers, and expectations. Now, Keilman model. This model is overlapping sector of healthcare as seen above that help people understand how an illness is identified and treated. It can be concluded that during a time of illness, we follow hierarchy of resort. This picture illustrates Keilman model that popular sector, professional sector, folk sector, all these are overlapping with each other. Now, what is popular group? Popular group people you see every day, maybe someone who has seen the illness or experienced it themselves. It is also at this sector called the popular sector, where the people will join self-help group or online support group. Folk sector. The next possible sector is the folk sector. This is not very common in Western society since we are a heavily biomedicalized culture, but an example could be someone with back pain going to get a massage to relieve some of the tension. In some other cultures, a sacred healers such as shamans take a holistic approach to treatment of these illnesses. These are the folk sectors. And professional sector is the final step and the most popular in Western society is the professional sector. This is when doctors become the healer of the folk sector. The patient is now under control of the doctor who can prescribe medication, label them as sick or healthy, and ultimately seclude them from others. Now, implementation of these sectors. Implementation of popular sector. Maybe a family member or friend tells you that mom keeps forgetting how to unlock her door, or dad cannot remember how to open the tackle box, even though he has been fishing since he was a boy. You're now questioning and watching mom or dad more closely. Once you start to realize some differences, you may look up some possible causes for these situations. Folks are besides medications, early stages of dementia, patients have recorded tips on living with dementia. Keeping a calendar and notes everywhere, using a medication dispenser, having a newspaper delivered to remember dates, and exercising are a few examples of how to make life easier. Once a progressed state of dementia has reached, medications and professional input is then required. Now, professional involvement is once you have a strong understanding on what is happening, you will most likely take the individual to a doctor. Since they have the power to diagnose, it solidifies the situation going on and it almost is necessary step before further measures are taken. Most people in Western society, especially, they need the doctor for a verification. This is definitely very understandable with an illness as transparent as dementia. For proper functioning of the country, the main sectors of any health system include the following. public sector, civil society, NGOs, and the private sectors. Now, what is decentralization? The transfer of authority and responsibility for public functions from the central government to subordinate office or quasi-independent government organization. Decentralization can be considered under deconcentration, delegation, and devolution. Now, what is deconcentration? This is the shifting power from the central offices to peripheral offices of the same administrative structure. For example, provincial department of health system and its district offices. Delegation in which responsibility and authority is shifted to a semi-autonomous organization. For example, board of governors to of an autonomous hospital. Local government is found at the lowest tier of administration in each state. Now, devolution. This shifts responsibility and authority from central offices to separate administrative structures still within public administration, such as elected local government. They may raise their own revenues and have independent authority to make investment decisions. While devising policies for health issues for target population, the provinces must keep in mind about equity. Aims of decentralization. Decentralization is expected to improve the health sector performance through one is improving allocative efficiency, second, improving production efficiency, third, service delivery innovations, fourth, improving quality, transparency, accountability, and legitimacy, and fifth is bringing about more equity. Decentralization in Pakistan. Pakistan's current provincial decentralization came into effect with the passing of the 18 amendments to Constitution on April 19, 2010. This was not a technical aspect, aseptic measure. With a unanimous consensus of all political parliamentary parties, 21 sectors were devolved to the four provinces. The provinces were to now legislate, steer, and manage the health sector as per their budgetary constraints. Recruitment of doctors and their salaries has the greatest portion of the total health expenditures. History, but we must not confuse or mix this with the prior attempts at decentralization. There were attempted as the part of local government reforms in 1959, 1971, and 2001. Purpose of decentralization: to transfer the power from federal to local government, to authorize the provinces to devise policies for health issues, keeping in mind the needs of people as they are closer to the targeted population, and third, to devolve decision making regarding health matters. Shift of power. The 2010 devolution provided an exclusive shorter list of federal powers and a longer list of exclusive provincial powers. The function of health planning, legislation, service regulation, financing, service delivery, human resource production, and service delivery programming were devolved to the provinces. Now, analysis of health progress. Analysis of health progress against some of the core objectives for which devolution was passed. First is, did devolution result in health getting a more equitable share of the government funding? Did provincial policy role led to improvement in health planning process? And third is, did provinces implement more locally responsive solutions? Now, this picture shows has there been more spending on health. This shows the budget of for health system in Punjab, in KPK, Balochistan, and it also shows provincial health budget spending by salary versus non-salary. Now, this shows has planning improved. It shows about the planning in Punjab, in KPK, Balochistan, regularity authorities, minimum service delivery package, service delivery integration, and private sector harsdening. In most of the provinces, the planning process moved downstream to the development of district health plans. Roadmaps are in place in Punjab, KPK to improve public service delivery using defined targets, regular stock takes, and investment in digitalized monitoring. So far, they remain unevenly implemented, only partially adjusted within the health budgets, and are frequently deviated from in favor of ad hoc schemes that have electoral visibility. Now, what are the measures that we can take to make the health system better? First is needs a health leadership training. Second is professional human resourcing. Third, latest technology is required to make the things better. Financial management system to deliver to speed and discourage frequent transfer and postings at senior management level. And political pressures should be organized in a proper way. And all these are the things that can be adopted to make health system better. Now coming towards the recent updates, article recently published is the impact of devaluation on the government size and provision of social services. That is evidence from Pakistan. This paper provides empirical evidence on the association between post 2001 devaluation reform policy, government size, specific amount of government expenditures based on the sample of panel data of provincial units in Pakistan from 1990 to 2015. The results demonstrates that devolution is associated with a larger government size, which provides empirical support for the common pool hypothesis, implying that decentralization that matters for the size of general government depends on how subnational governments finance their expenditures. Moreover, the findings suggest a significant increase in the magnitude of health and education facilities at the local level following the devolution reforms. Another article published is Decentralization and the limits to service delivery evidences from northern Pakistan. The results demonstrate that political dynamics, such as nature of the relationship between district government and provincial government, extent of political polarization prevalent within or among different levels of the government system, and the roles of bureaucracy turn out to be important factors that account for the deterioration of well-being outcomes in Sawabi districts over the course of decades of implementation of the local government system. Another article published is Health System Changes After Decentralization, Progress, Challenges and Dynamics. It shows that in decentralized Pakistan, health became prioritized for increased government resources and achieved good budgetary use. However, allocation priorities were not effectively adjusted, and there was little efforts at targeting of inequities. First is investment for technology capability development, technical support for the central level to shift a new mode. Measures are needed for political management of decentralization to safeguard against local political pressure, leadership stability. Devolution is a form of centralization in which responsibility and authority is transferred from central offices to central administrative structures within public administration, such as elected local government. Now coming towards the MCQs. First MCQ is devolution shifts responsibility and authority from central offices to separate administrative structure. After devolution 2010, which items in the government budget accounts for the greatest portion of the total health expenditure? Option A is recruitment of doctors and their salaries. Option B is purchasing new technologies. Option C, building new hospitals in public sector. And option D, training of new frontline healthcare workers. Uh, Option A is the right one. Recruitment of doctors and their salaries has the greatest portion. Now, second MCQ is with devolution, there is transfer of authority from federal to provincial government. While devising policies for health issues for targeted population, the provinces must keep in mind which of the following. Option A is equality, option B equity, option C traditions, and option D beliefs.
B.
Option B is the right one. Equity should be kept in mind. while devising policies. Third MCQ is an organization deals with the policy making and implementation. In this organization, the decision making freedom is available to the lower level manager. This is an example of option A is decentralization, option B centralization, option C autonomy of effort, and option D congruency.
A.
Yes, it is an example of decentralization. Option A is the right one. Fourth MCQ is Bilal is an 8 years old boy that still wets his bed almost every night. He is ashamed of this and is ridiculed by his cousins. His parents are worried and take him to doctors who refers him to a psychiatrist. The child gets medication and returns home. According to Keilman's model, this is an example of option A professional sector, option B folk sector, option C popular sector, and option D personal sector.
D.
Uh, Option A is the right one because he was taken to psychiatrist. So it comes under the domain of professional sector. Option A is the right one. It's professional sector. Uh, Fifth MCQ is a TV compare becomes terrified of speaking in public. He cancels his speaking engagements for fear of getting embarrassed. Instead of seeking treatment by a trained health professional, he joins an online support group for changing his perceptions and beliefs. This is an example of option A is professional sector, option B is folk sector, option C popular sector, and option D is the personal sector.
D.
This is an example of popular sector. Option C is the right one because he is joining a group of people for changing his beliefs and perceptions. Now, sixth MCQ is little Ali has recurrent allergies and must receive injections to counteract them. He became fearful and cried whenever he gets his injection. The father decided to take him to Hakim for traditional medicine. Now, this situation is an example of option A is the professional sector, option B is folk sector, option C popular sector, and option D personal sector.
D.
Option B is the right one, professional sector, because he was taken to a Hakim for medication. Now, seventh MCQ is a 30 years old lady who is 38 weeks pregnant refuses to have cesarean delivery, even though without surgery the fetus could die. Doctors fails to convince her, and she seeks advice from a lady in her close relative for choosing the better mode of delivery. According to Keilman model of health system, this is an example of option A professional sector, B folk sector, option C is popular sector, and option D is personal sector. Uh, Option C is the right one, popular sector or group sector, because she's taking advice from her other friends. Eighth MCQ is the 2010 devaluation provided a longer list of exclusive provincial powers that is charged with finding, screening, recruiting, and training job applicants and administering employee benefit programs. This all comes under the domain of option A is legislation, option B is service regulation, option C financing service delivery, and option D human resource production. Option D is the right one. All these are under the domain of human resource production. Ninth MCQ is Pakistan's current provincial decentralization came into effect with the passing of 2010. Public administration, which is found at the lowest tier of administration in each state, is in the form of option A is provincial government, option B is federal government, option C local government, and option D union council.
D.
Option C is the right one. Local government comes at the lowest tier of administration. Now, last MCQ is for proper functioning of the country, the main sectors of health system include the public sector, the civil society, the NGOs, And which of the following factor is missing? Option A is private sector. Option B is religious sector. Option C, teaching and training sector. And option D, heritage sector.
A,
Yes, option A is the right one, or private sector is the fourth pillar. This is the key. These are references, and thank you.
Thank you very much. Very nice presentation, Dr. Isma.